Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about a crooked knee after knee replacement surgery. Before I jump into this, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So when we're talking about a crooked knee after surgery, typically what we're looking at is where if you're looking at your knee either standing still or just in a regular position, not moving, static position, or with functional movements or dynamic movements, is there's not this straight, good alignment of the knee. It might seem like the knee's bending inward toward the middle a little bit, or it might even be less commonly that the knee's bending out to the side a little bit. And a lot of people who have arthritis of the knee and prior to having a knee replacement can develop some joint deformities of the knee. And the most common ones are going to be that knock knee deformity, so the knee is coming in toward the middle, or what we also refer to as a valgus deformity. And there's also a varus deformity, and that's the bow-leggedness, so the knees are bending out toward the side. And with surgery, your surgeon is able to pretty well most of the time restore good alignment to your knee joint. And this comes from, when they make the cuts to the bone, they're able to make the cuts appropriate to help adjust that fit. And there's also a balancing of the knee, it's called, where they're looking at the length of the ligaments on the sides of your knee while the surgeon bends and straightens your knee, and making sure those ligaments are balanced side to side, the amount of tension. Sometimes you have to cut the ligament a little bit to loosen it on one side or the other, or tighten it up on one side or the other to get that good balancing, that good alignment of the knee. Now, unfortunately, this doesn't necessarily mean that every single knee replacement is going to have really great, awesome alignment. There are some limitations to this. There can still be people who get knee replacement and the knee just looks angulated. It doesn't look perfectly straight, perfectly aligned. And there's different reasons for this. Some of it is just normal variations in people's anatomy. Some of it is just chronic changes and chronic conditions and doing the best we can with the knee and the structures that you have. And there's some other possible causes. But what you want to look at is look at your movements and look at your knee both static, so standing still, sitting, laying down. Look at the alignment in that position, and then look at the alignment with dynamic movements. So look at the alignment of the knee with walking, with getting up and down from a chair, with going up and down stairs, things like that, dynamic movements and motion. And you might need your physical therapist, or you might need a family member or someone to help you observe and help you look at the knee and tell me, does my knee look straight when I do this? Does it look angled? Does it look like there's a little angle? And a lot of times you're going to see a more pronounced angle, more pronounced crookedness when you're doing the dynamic movements rather than when you're when you're just static or standing in place. And this is often because your leg and your body is connected. The different joints of your body are connected in the fact that if you have something, a change in alignment or a change in rotation or whatever that may be at your hip, it can affect what's going on at your knee, and it does affect what's going on at your knee, and it affects what's going on at your ankle. And the same thing if there's something going on at your foot and ankle with alignment, with positioning, it can also affect your knee and your hip as well. And so we're not necessarily going to change the alignment of your knee. Hopefully you had some pretty significant improvements in that alignment with the surgery itself. Not really going to change that knee alignment just by focusing in on the knee. What we want to look at instead is up at your hip and kind of your low back area and your pelvis, and we also want to look down at your foot and ankle. So let's start at the hip. First of all, we want to make sure you have good alignment of your hips and pelvis. So think about when you're going up and down steps, when you're walking, when you're standing up or doing a squat or something like that. Does the alignment of your pelvis, do both sides kind of end up at the same height, or does one side tilt? Is there this asymmetry in the alignment of your pelvis? You also want to look at your hip joint. Is your hip rotated inward toward the middle, or is it facing straight forward? Is it rotated too far out to the side even? And you want to take a look at that. And what we can do to improve that is, one is strengthening. So making sure we have good strength of the muscles around the hip joint. And the big ones are going to be your gluteus muscles. So your gluteus maximus, but also the deeper muscles, your gluteus medius, your gluteus minimus. And those muscles provide that good alignment and strength at your hip with functional movements and dynamic movements. So having good strength in the hips. We also want good flexibility in the hips. So it's not uncommon to have tight hip flexors. So those front part of your hips, those front muscles of your hips can get really tight and stiff. When we sit a lot throughout the day, just kind of our general environment and how we function day to day. So stretching out that front part of the hip, doing some mobility exercises and stretches and range of motion activities can be really helpful as well. And then the other thing is just practicing moving and motor control activities with good alignment and good positioning of your hips and pelvis. So practicing a lot of squats, practicing going up and down steps, practicing getting up from a chair or walking, and doing it with a focus and an intention of doing it with good alignment and good positioning. Now we also want to look at your foot and ankle again. So common things, is it pronated or that flat foot deformity? So the foot kind of rolls or rotates out toward the side. Or is it excessively supinated? So that's that having a high arch and the foot kind of rotates toward the middle of the body. And we want to look again at the difference between static, standing still, and with dynamic movements. Again, you're probably going to see some more pronounced impairments with more dynamic functional movements. And again, it's the same principles as at the hip. So we want to make sure we have good strength and stability around the foot and the ankle. Can you stand on one foot and maintain that single leg balance and maintain that good positioning of your foot and ankle? Can you do single leg tasks like a step up or a lunge or a single leg squat, partial squat maybe? And then you want to look at the mobility again. And the big thing for the ankle is your ankle dorsiflexion. So that's the ability of your to bring your toes kind of up toward your head. And it's not necessarily when you're walking and moving, but when you're on a firm surface or a closed chain movement, we call it. Can that ankle move and bend how we want it to with different functional dynamic movements? So doing a lot of mobility exercises, doing some stretches for your calf muscles can be really helpful in this regard. And then again, we go back to looking at that motor control and practicing movements with good alignment, good control while you're doing it. I always like to have people, when I'm seeing them in physical therapy in the gym, focus on control, focus on good mechanics, good technique, good alignment when you're moving. We want to get that down first before we focus on doing, a full, complete range of motion, or we want to focus on, doing it really quickly or with a lot of weight and a lot of resistance, whatever that may be, whatever your goals are. We want to focus on that good technique, that good stability, control first off. So I hope this helped give you a little bit of some insights into, what you can do to help manage and help improve that crooked knee after surgery. If you have any questions, please be sure to leave them below and I'll do my best to get back to you. Hit that like button if you found this helpful to help spread this video to other viewers, and I thank you for watching.